I was an expert witness at the inquest for Stephen O'Neill, who was killed by a drug called sertraline that had been put on by his family doctor. I was hoping that the coroner, who's a decent man, will be able to help me with a problem I had with the case, a problem that he and his family could have if he or his family are put on drugs, or that you and your family could have if you put on any treatments at all, which is that in Stephen's case, and in your case, doctors don't see or hear you anymore. And part of the reason that they don't see or hear you is that they're listening to and looking at something else. The something else is called evidence. But in fact, the so-called evidence is the greatest concentration of fake news on earth. Much greater concentration of fake news than the news that Donald Trump complains about as being fake. Fake is a pretty strong word, but when I use it writing to regulators who approve drugs like the FDA in the United States or the MHRA in the UK or EMA in Europe, they don't complain. They just say, well, it's not our job to police this problem. When I use this word writing to the people who make the guidelines that dictate the treatments you or I get, guidelines that invariably say, you should use the latest and most expensive treatments, and guidelines that don't mention the problems that a drug causes because the guidelines are built on the fake literature that is out there. The guideline makers don't complain either. They just say, well, this is not their problem to police. When I write to government departments or chief medical officers about the issues, they also recognize the problem, but they throw their hands up and say, well, look, this is the system worldwide. What can we do about it? The people who are best placed probably to do something about it are your doctors, the people who give you drugs. If they were to say, look, we're not going to give you drugs unless the literature is dependable on, unless we have access to the data behind the trials that have been used to approve the drugs, then we'd all be a lot safer. But they don't do this. Instead, when they hear a message like this from someone like me, they look fit to kill me, even though this is a message that's key to keeping doctors in business. If the drugs work wonderfully well and are free of problems, well, we don't need the expensive pill dispensing machines that many doctors have become. What do I mean by fake? Just to come back to this word. Well, what I mean is this, that the clinical trials that bring drugs on the market are reported in medical journals, the best medical journals there are, like the New England Journal of Medicine or the Lancet, and they have authors on the authorship line who are distinguished medical academics from Oxford or Cambridge or Harvard or Yale or Paris or Berlin. But actually, in fact, these aren't the authors of the articles. The authors, in the case of articles about on-patent drugs, will invariably be ghostwriters who are working to a pharmaceutical company brief so that the articles include the commercial messages that the pharmaceutical company wants in there. Neither the ghosts, nor the academics, nor the regulators, nor the guideline makers get to see the data behind the claims being made, the data from the clinical trials. No one gets to see it. How can I sit here and say this to you? Well, I'm one of the few people who has gotten to see it. You can get to see the data if you're an expert witness on behalf of someone who has been injured by treatments in the United States, not anywhere else. When you get to see the data, what you see is that in some cases, the patients don't always exist. The handy thing about patients who don't exist is that they can't die on treatment and they can't be injured by the treatment either. What you also see is that the complaints that someone like you or I might have on treatments that our doctors dismiss as anecdotes these days are in fact there in the data. The pharmaceutical company knows about the problems you will have, while at the same time they're denying in public that their drug could ever cause this kind of problem. So, how do we move forward from here? One of the issues is doctors used to report problems. They used to know that these drugs, the drugs they used were poisons, out of which they could bring great good. But only if they remembered that they were using a poison, so that when you reported to them that something poisonous had happened to you, they believed you and they reported it to medical journals. But the medical journals these days are too scared to publish reports like this. Doctors rarely report to the regulators of drugs. Maybe in 1 in 100 of the serious cases that when things go wrong on a treatment, they'll report to the regulator. You and I are increasingly being encouraged to report to the regulators ourselves when things go wrong, but there's no point doing it because the regulator pays no heed to your reports when they come in. They may as well have been them. And part of the reason they pay no heed is that your reports of something that's happened to you on a treatment are dismissed these days as anecdotes. This defense was invented by the Paedophile Liberation Front in the 1970s, when faced with awkward questions about the harms that having sex with children might do to the children. They said, well, look, there's no evidence of harms. These are just anecdotes. This is an issue that we need to turn around because, in fact, your reports of what happens to you on drugs are better evidence of what's happening to you on a drug if your doctor remembered that he's given you a poison than the reports that are published in the very best journals we have. The trouble is we can't depend on doctors to get a grip of this problem, particularly at the moment when they figure that, when they're being widely praised as being the saviors of us all, saviors from coronavirus. In fact, however, most of the people who seem to be dying from this virus are the people who are on multiple meds, older people who are on 5 or 10 or more meds, many of which they simply don't need, medicines that may be compromising their ability to fight the infection when they get it. There's a problem here which needs to be put right. I've written to many of the honourable people behind the system we have in the UK and Europe, and I'm going to be making the correspondence with these people available on the O'Neill website, and I'd encourage you to pick it up and use it in your own country and your own situation to see if we can make the kind of difference that needs to be made, if you can help the O'Neill family move things forward. This is not a matter of holding people to account, of getting them to pay for what's happened. It's a matter of just encouraging the honourable people who are in charge of the system to recognise that things are not working right for any of us, and something needs to be done to put things right.